are from Group 2 and we will be presenting our assignment topic, which is National Mental Health Policy. According to Zhao and others, 2018, government statement about the principles, values, goals of mental health are known as mental health policies. In order to meet the needs of people in terms of mental health promotion, treatment, prevention, and early mortality prevention, mental health policy is very essential for the state because it identifies and promotes guiding principles, values, and standards for action. Mental health policy was developed by the Ministry of Health (MOH) in 1998 and has been amended in 2012. It was named as National Mental Health Policy. The evolution of the mental health policy started in the 1900s and it was a combination of British and Indian mental health laws. According to Chong and others, 2013, before Malaysia achieved independence in 1957, only people from the certain industry like rubber receive healthcare services. After the independence of Malaysia, the existence of the first Malaysia Plan made all citizens across the country receive healthcare services equally.
Before National Mental Health Policy existed, there were a lot of problems regarding the field. Some of it are insufficient number of medical schools to train psychiatrists, insufficient number of psychiatrists, and limited number of beds or space available to put all the patients. The first problem, which is insufficient number of medical schools to train psychiatrists. During the second Malaya Plan 1961 until 1965, the University of Malaya developed its medical faculty as well as its university hospital. The establishment of a department of psychological medicine marked a first for Malaysian medical school. According to Tan and Wenger 1971, state that undergraduate medical education now includes psychiatrists as a significant component. According to Won 1978, said that the Tampoy Mental Hospital opened its door in 1952. Thus, a university was founded in Kuala Lumpur in 1958, the year of the country's independence. According to Deva 2004, said that after that a medical school was established in Kuala Lumpur in 1963 and the first doctors graduated from there in 1969. On to the next problem, which is an insufficient number of psychiatrists. In 1928, there were 4 male and 4 female attendants from Europe, 1 senior assistant physician and 1 assistant physician, and 1 assistant superintendent in addition to the other staff members at Central Mental Hospital. There were 3,900 inpatients at the conclusion of the 1957 investigation. According to Won 1978, said that there were 5 doctors working at the hospital, including the medical superintendent, just as there had been in 1928. The last problem is the limited number of beds or space available to put all the patients. Within the first 3 years of its function, the number of patients at the end of the year exceeded the total number of beds. In 1912, there were 218 beds but 359 patients, and in 1930, there were only 453 beds for 520 patients. By 1928, there were 2,211 patients at the Federal United Asylum, Tanjung Rambutan, renamed the Central Mental Hospital.
Hello, my name is Asharanya binti Azahar. My student ID is 2023387821. The first objective is to provide a basis from which to develop strategy and direction for all involved in health and mental health planning and implementation, with the aim of improving the mental health and well-being of the entire population. Foundations, governments, healthcare organizations, and communities can collaborate to create a mental health and well-being strategic plan. This framework serves as a roadmap for addressing mental health at the population level, with the ultimate goal of enhancing mental health outcomes and general population well-being. It's a dynamic process that must adjust to changing conditions, new evidence, and changing demands. The second objective is to improve mental health services for the population at risk of developing psychosocial problems. Communities and healthcare systems can collaborate to build a comprehensive and effective strategy for enhancing mental health services for people at risk of developing psychosocial difficulties. The goal is to promote mental health, prevent the beginning of more serious mental health conditions, and guarantee that everyone has access to the help they require. The third objective is to improve psychiatric services for the mentally disabled in terms of the care provided by family, community, and the relevant agencies. Improving psychiatric treatment for people with mental illness requires a joint effort from families, communities, and relevant agencies. It necessitates a multifaceted approach that focuses on stigma reduction, promoting awareness, assuring early intervention, and emotional support, providing accessible resources, and developing a feeling of community. Collaboration among these three major stakeholders is critical for developing a more supportive and successful mental health care system for people with mental disabilities.
Assalamualaikum. My name is Muhammad Hidayat bin Safri, and I will explain the strategies for achieving the objectives. The first strategy to achieve the first objective is to develop a national mental health strategy. For example, the Malaysian government established a national mental health task force comprising mental health experts, representatives from government agencies, non-governmental organizations, which is NGO, and community leaders. This task force is responsible for overseeing the development of the national mental health strategy. The second strategy is to promote mental health education. For instance, the Malaysian Ministry of Education revised the national school curriculum to include mental health education as a mandatory subject in primary and secondary schools. The curriculum covers topics such as understanding mental health, coping with stress, recognizing signs of mental health issues, and seeking help. Next, the second strategy to achieve the second objective is to do the targeted prevention programs. The Malaysian Ministry of Health, in collaboration with schools and youth organizations, established a youth resilience program. This program focuses on building resilience and coping skills among adolescents. It includes workshops on stress management, emotional regulation, and problem solving. School counselors and mental health professionals conduct these workshops, and they are integrated into the school curriculum. Next, the strategy is to do a community-based mental health service. For instance, community mental health clinics. The Ministry of Health in Malaysia established a network of community mental health clinics in urban and rural areas across the country. These clinics serve as accessible entry points for individuals seeking mental health support. Lastly, the last strategy to achieve the last objective is to be involved with family and community. The Ministry of Health, in collaboration with mental health organizations, conduct workshops and training programs for families of mentally disabled individuals. These programs aim to enhance family members' understanding of mental health conditions, coping strategies, and how to support their loved one effectively. Next strategy is to do mental health services integration. Like Malaysia develops and implements training programs for primary care providers, including general practitioners, to recognize and manage common health mental issues. This training identifies symptoms, conduct basic assessments, and offers initial support. Thank you.
Before formation of Peninsular Malaysia, Sabah and Sarawak, Malaya only had one medical school in Singapore, and after the formation, University of Malaya built in 1963. University of Malaya became the first medical school in Malaysia and offers psychiatry program. After that, the medical school grew starting in the early of 1970s. Before policy formulated, there are only 5 public medical schools offering psychiatry program, and after the policy, there are increasing in medical school offer psychiatry program either in public or in private. UKM has claimed that they have successfully given birth to a psychiatrist, and it will increase the number of psychiatrists in Malaysia. The second objective of National Mental Health Policy Malaysia is to improve mental service for the population has achieved. By having key performance indicator (KPI), it sets standard for the employees to achieve their organizational goals. It can be proven that when the hospital mental in Malaysia has the highest rate of hospital discharge rate per 100,000 population for all mental cases except for the Europe countries. Hence, it can be proven that the treatment of the mental health in Malaysia has high quality and improved from the era before the existence of the National Mental Health Policy. As stated by Wu 1978, before the existence of the policy, there was an inadequate treatment to treat the patient of mental illness. Here, we can conclude that nowadays the treatment of mental illness is adequate since the Ministry of Health itself has claimed that the treatment is effective and as many as 70 until 90% of individuals, the symptoms of mental illness are being reduced.
The third strength of the policy is its ability to increase the number of government and private organizations that provide mental care. Government hospitals are important in providing mental health care at lower cost, given the rise in cases of mental illnesses, particularly depressions following the MCO in 2020. Before the policy's implementations, a general psychiatric hospital was created in Penang in 1985. This demonstrates that Malaysia spent a long time to construct a hospital for mental patients as well as it remains insufficient to handle psychiatric patients in Malaysia. In Malaysia, there are 4 main public mental hospitals and those who are actively suffering can get stabilizations and rehabilitations at these institutions. In addition, the private sector was formerly forbidden from offering psychiatric treatment, but they are now encouraged to collaborate in providing care. As a result, the public can also seek treatment in semi-government or private hospitals if they are ready to spend more money and want to spend less time for the treatment at the clinics or hospital. Next, I will present about weaknesses. One of the weaknesses of the policy is the lack of mental health professionals. Mental health professionals such as psychiatrists and psychologists are those who provide services to treat mental diseases. Compared to other fields, the study of mental health professionals requires substantial financial resources and a significant amount of time to acquire the necessary skills and experiences. The shortage of professionals in this field existed even before the implementations of the policy. In 1977, there were 4 mental institutions and 10 general hospitals, but there are only 17 psychiatrists. According to a 2018 research, Malaysia has a serious shortage of psychiatrists and psychologists with a ratio of 1.27 psychiatrists per 100,000 people. The problem of a lack of mental health experts does not exist in urban areas because urban areas such as Kuala Lumpur have the highest ratios of psychiatrists compared to other cities, which make it harder for them to seek treatment. The shortage of experts in rural areas is extremely worrying because most mental health issues originate in these areas rather than urban ones. The lack of experts will not only make it difficult for the people to receive medical treatment, but it will also force patients to wait a long time just to seek therapy due to heavy workload. Patients, for example, must wait more than 2 hours when they only need to meet doctors for 15 minutes. One of the causes that public hospitals' lack of professionals is due to a big difference in salaries between private and public hospitals.
Despite the government have putting a lot of effort and spending the big amount of money on this policy during national budget, there are still a lot of Malaysians who are not aware of how dangerous the disease is. The Malaysian government has spent millions amount of money to educate the people about the importance of mental health and the seriousness of getting the treatment when having a symptom. However, some part of the society choose to ignore them. This can be proven when only 20% of Malaysians who suffer from the disease go seek help from the professional. They are not going to see the psychiatrist because the lack of knowledge regarding the disease and the treatment. In fact, strong stigma and negative perception of mental illness from the society and even from the mental illness sufferer are one of the factors why 18% of Malaysians that suffer the disease did not help themselves to seek the help from the professional. The society needs to step up in its game to change the perspective of the public on the mental illness, and they cannot rely on the government who have done their part.
The last weakness is stigma and discrimination. Stigma and discrimination wasn't something new in Malaysia, especially when it comes to mental health. through the policy, Malaysian government has taken various actions to address these problems, but in spite of this initiative, it still exists. Stigma and discrimination towards people that are suffering with mental health such as anxiety, depressions, and bipolar disorder happen openly, not only from the society, but their professionals in the healthcare field also have this kind of bad mindset. Most Malaysians will relate people that are suffering with mental health disorder with crazy or psychic jiwa. For example, a 2018 study published in the International Journal of Mental Health Systems found that people with mental illnesses face stigma and discriminations in healthcare settings in Malaysia. According to the findings of this study, prejudice includes massive attitudes, unfavorable stereotypes, and a reluctance among healthcare workers to connect with individuals experiencing mental health challenges. This kind of issue has happened even before the implementations of the policy, since the general people lack knowledge of mental health concerns due to the misconceptions of that people with mental health issues are unpredictable or dangerous. Stigmatizations resulted from this. That's all from me. Next, I will pass to my other group members.
To address the weaknesses of mental health in Malaysia, several key strategies can be implemented. First, increasing workforce. For example, incentive programs like Singapore should be implemented to recruit more medical professionals, especially psychiatrists. Other than that, reducing pay gap between private and public medical professionals will attract more talent to public healthcare facilities. Moreover, the government may also expand scholarships in the field of psychiatry by providing government-sponsored scholarships like Hadiah Latihan Persekutuan HLP to encourage more students to pursue psychology studies. This will result in an increased number of mental health professionals addressing the shortage issue. The second recommendation is to provide mental health education, workshops, and campaigns. Organizing seminars, campaigns, and workshops will raise awareness of mental health issues in communities, businesses, and educational institutions. This initiative should educate both adults and youth on how to recognize and deal with mental health emergencies. This program should focus on the relationship between mental health stigma, reduction, and so on. For example, the Time to Change campaign in the UK shows how public awareness campaigns can combat stigma and prejudice. As such, increasing in mental health education will improve overall awareness. The third and the last recommendation is to provide training for healthcare professionals. Healthcare workers include doctors, nurses, and psychologists should receive extensive training. The training topic should be on understanding the impact of stigma and promoting non-discriminate practices. For example, collaboration between organizations like MHAM and the Ministry of Health is important to develop and implement effective training. Active involvement of these agencies can reduce stigma and discrimination in mental health care, fostering compassion and empathy among healthcare professionals. By implementing these strategies, Malaysia can work towards improving mental health care and increasing the number of mental health professionals, also fostering great awareness and understanding of mental health issues in the community. And that's all for the recommendation on how to solve the weaknesses of mental health policy in Malaysia. Thank you.
In conclusion, while the mental health policy did not completely achieve its goals, its implementation was a promising start towards lowering the number of patients suffering from mental disease. However, the mental health policy still has flaws that should be addressed to reach all objectives. Malaysia's government should pay more attention to the public's mental health, particularly teenagers who regularly suffer from mental health concerns as a result of family conflicts, friends, and relationships. The stigma of people suffering from mental health disorders persists in society, and we must work to change this image by educating them more. To summarize, in order to ensure the policy's effectiveness and efficiency, every party, whether government, public or private, must cooperate together.